Remember that we are the only surgical profession in the field of medicine where the patient is fully awake. And so the patient is watching your every move. Let me just tell you that I get bored very quickly.
Okay.
So every 10 years, I have to change my focus. And what most people's misconception is that digital dentistry is just scanning teeth. But that's a very minuscule part. Our generation would like to think that we've been at the vanguard of change. And we've been responsible for some of that change that has happened. One day I told my father that, look, I don't want to take science and I want to become a journalist. So my father didn't say anything. He said, you know what? Yeah, you take your choices, whatever. Lasers were marketed completely wrong. A laser is not a restorative tool. It's not a handpiece. It's a surgical tool. The high point of my career was when I was invited to lecture for the perio grad students at the Harvard Dental School. Dentistry in a lot of ways is a wellness treatment. It's not a sickness treatment.
That's such a great line. Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast. Our guest for today is Dr. Suchetan Pradhan. He has completed his Masters in Prosthodontics from Mumbai in 1986 and has finished his MSc in Laser Dentistry from Germany. Dr. Pradhan has over 30 years of experience in Implantology. He is the head of dentistry in Hinduja Hospital, Mumbai since 1990 and is the director of Pradhan Dental Centers in Mumbai. The audio podcast is available on Spotify and Anchor. The links to that and the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Pradhan, you have incorporated a yoga session in your implant program, if I'm not wrong. How does that work?
So basically, the fact is that implants are a very... So let me start by saying dentistry is a very difficult profession. Simply because you need so many skills to be able to be at the top of your profession. So one of those skills is, of course, focus. Remember that we are the only surgical profession in the field of medicine where the patient is fully awake.
Yes.
And so the patient is watching your every move. So your focus is extremely important. Your concentration, meditative qualities, dynamics, those kind of dynamics are very important for that. And so when you're doing for the first time, for the young people, for example, for them to do implants, it's a very stressed area. Okay. So we need to relax them. Also, your physical well-being is very important for your mental health.
Absolutely.
And vice versa.
Absolutely.
And vice versa. So we thought it would be great to have a yoga teacher, and we have a very good yoga teacher called John Quill Cooper from the UK, who did. So this was the one I introduced last year.
So you've already done.
Oh yeah, we've done
sessions.
one session of about.
And 2 how was the feedback?
So the feedback from the participants was amazing, and they were really happy that we did. I also taught them in another session ways to concentrate.
Just concentrate.
To focus. Okay. How do you focus? Okay. So, you compartmentalize your thoughts and then you take a little ray of light and go from one compartment to the other. Okay. So that really helps your focus. And I think that also there was a good feedback on that. So yeah, we're going to keep a half-day session on yoga and modes of concentration so that they can funnel their energies in the right way, rather than getting stressed.
So when they learn implants with you, they learn not just implants, they learn much more than that.
Well, we hope that we can give them a fully well-rounded, a holistic kind of an education, which they can go back into their practices and implement immediately after they finish the program.
Is that the approach you're going for, the holistic approach?
Yeah. I believe in that. Even in our practice, for example, we want a holistic approach. I think dentistry is the gateway to health, because it's the oral cavity, which is the gateway. And you can find a lot of things in patients which are medically compromised situations, which you can identify with your teeth.
Got it.
So it's important to understand the whole holistic mechanics of dentistry.
So how did your love for implants start?
So let me tell you, when I was in BDS, and I just joined MDS. I'd finished my BDS and just joined MDS. And in 1984, the first book by Dr. Deshmukh was released. And I was I used to be one of those guys who used to sit in the library and chat up with the librarians and stuff like that. And so whenever the new books came in, she used to give them to me and say, "Oh, read this. It might be interesting." So the first time I saw the story of osseointegration was in 1984, and that I read that book cover to cover in about 2 days, and it really interested me. So I said, "Okay, let me finish my MDS, then I'm going to go to the US and learn implants," and that's exactly what I did, and that's where my passion for implants started.
So it won't be wrong for me to say that you must have worked on almost all the implant systems there are out there.
The accepted ones, yes.
Okay.
Because in those days there were a lot of cowboys, and so there were a lot of different kinds of implants, spiral implants and stuff like that. But yes, the ones that were universally scientifically accepted. I'm sorry, I have a little cold. We were scientifically and universally accepted at that point, with some kind of scientific data behind them. Yes, I've tried most.
Are there any systems which you have not worked with?
No, I didn't. I hadn't worked with the Straumann for a long time. But then I've started working on that in the last 4 years. I'm very happy with it.
Okay, great. Any advice for students out there who are about to start placing implants and restoring them? Your advice for them?
So the first thing is get yourself educated properly.
Okay.
Because again, an implant, the whole curriculum of implant is that you're going into a backward integration.
Right.
That means you should know what you're going to be finally doing for the patient before you start placing your implants. So unless you are educated properly, and that's really the most important thing, educate yourself in every aspect of implant dentistry, and then it's all easy. And then it's just a matter of practice, doing more and more and more till that 10,000 number is reached. Of course, that takes a long time with implants, but once that is reached, of course, even before that, your hands are set, your mind is set. You don't have to think about parallelism. You don't have to think about where you're going to place the implant. It comes naturally.
So you mean to say you should know the basics and be consistent at it, and then eventually you will get good at it?
I would say that initially, if you have a mentor-guided approach, that would really help, because the mentor can tell you what little errors you're making. I wouldn't call them mistakes. I would say just little errors that you can improve your technique by just following the examples of people who've done them at the highest possible levels.
So when you talk about a mentor, how important is the role of having a good mentor in dentistry?
I think it's very important.
And should everyone have one?
To be fair, I never had one.
Okay.
Till I met somebody called Paolo Malo, and who inspired me. But that was much later on in my life. I met him when I was in my 40s, not before that. But before that, yes, I was inspired by a lot of people because of what they did. But I wouldn't say that I would follow them and, that I would take everything that they did and do it in my practice. Because remember, everybody's different. What may work for you may not work for me.
So you also incorporate a lot of digital dentistry in your practice. What's your definition? Because out there, people have different definitions. What's your definition of digital dentistry?
So let me just tell you that I get bored very quickly.
Okay.
So every 10 years, I have to change my focus. And so my first focus was, of course, prosthodontics, which was my master's. Then I did implant dentistry for 10 years. I concentrated my energies on that. And then in 1997, I started looking at lasers. So that was my next interest area, which I did pursue for 10 years. And again, we did a lot of work on that. And then in about 2010, I started thinking that digital dentistry would be the way of the future. And so I got the CEREC, one of the first CERECs in this country.
In 2012?
In 2012, I got my first CEREC, 10 years back. And then once I could see what it was doing, then I started incorporating other areas of digital dentistry into my practice.
Okay.
So I think what we need to understand is digital dentistry is a whole new format which incorporates collection of data, identifying and planning the data,
right,
collating it, and then planning for the treatment modalities, and then executing the treatment modalities. So it's a whole new world if you look at it. So how do you capture the data? I mean, you could do CBCTs, and we got the CBCT in, I think, again, in 2008 was the first CBCT that I bought. Okay, now I have 2 CBCTs in both my Bandra and my Juhu practice, and we are looking to get one in the Nariman Point as well. So you capture the data by your CBCT. You can also capture the data with scanners.
Okay.
So what most people's misconception is that digital dentistry is just scanning teeth. But that's a very minuscule part.
That's how it's been marketed right now.
Exactly. So companies will market what sells for them, right? So yes, and it's a great way of doing it. You can scan. You don't need impression materials. But then you need software
Right.
to plan with the data that you've captured. And there are different softwares, amazing softwares available for all kinds of things, for smile design, for implants, for crown and bridge, things like that. And so you incorporate that, you plan it, and then you have milling units and 3D printers, which will enable you to deliver the planning stage into your prosthetic options that you have. So even from guided surgeries so the guide sleeves, you incorporate that in your guides. And then you can mill abutments today, you can mill anything, right? You can mill titanium, you can mill ceramics, you can mill feldspathics, you can mill, lithium disilicates. So you have all of these milling options available to you to get what you want in terms of function and aesthetics for your patient.
Right. So can you explain to us your digital workflow in brief?
So what we do is, I don't do a lot of guided surgeries except for all-on-4 for large cases because of my experience with implants. But if you're a younger person, you should do that in your practice. But please understand that a guided surgery is not nirvana. Okay? You have to understand the basis of implants.
Right.
Again, companies will sell you, use this guide and place an implant. But if you don't understand that it's the stability of the guide that is most important for your implant positioning, and then so obviously you start from there, and then you go forwards with. So we don't use guides, but we scan most of our implants now. Of course, we have CBCT, so planning stage. We have all the softwares that are available with us that we plan our implant treatments, and then we scan. And then we sometimes mill the abutments if you have to change the position, or you're using stock abutments. And then, of course, we mill the prosthesis. So we have now 5-axis milling units as well in our practice.
Okay, great. So you did your master's in prosthodontics in 1986 or 7?
I finished in 86.
Okay. So how was the MDS experience for you, and why did you choose prosthodontics?
I would have liked to do surgery, but it's a difficult. So in those days, there was not that much opportunity for surgery.
Okay.
So I thought that it would be a good, and I was always interested in aesthetics.
So you mean to say the scope was limited as a clinician when you did surgery back then?
In the 80s, because a lot of the surgical work that you were getting were mainly impactions.
True.
Because most of the other work was going to 1 or 2 oral surgeons who were well established, and mainly to plastic surgeons.
Okay.
So the opportunities, if you did your oral surgery, you are limited to doing it in your practice, minor surgeries. And if you got a hospital attachment, then you were fighting with orthopedic surgeons and plastic surgeons to get those cases.
Absolutely true.
So that was, and it's still the case.
Yeah.
Not as much today because we are recognized as a specialty. But yeah, 35 or 37 years back, it was really that was the case. And so prosthodontics was an option that I always thought because I was very interested in aesthetics. My mother being a theater actor in those days, it really helped because I met a lot of people whose accent was on aesthetics, culture, that kind of stuff. So that propelled me into doing prosthodontics. And of course, I got my MDS. Remember, those days, there were no private colleges. So
you did from Nair Dental?
I did my BDS from Nair and my MDS from Nair. I was in Nair from 1979 to 1986, 7 years.
Wow. Almost a decade there.
Spent a great time there.
So how was the MDS experience for you? You got 3 years there. How was it?
Those days it was a 2-year experience.
Oh,
it was
okay.
not a 3-year experience.
Sorry, I didn't know that.
Yeah. So first of all, unfortunately, they weren't teaching us a lot other than full dentures and maybe crown and bridge. But remember those days, ceramics was like doing brain surgery. So a ceramic crown was considered like the epitome.
That's crazy, right? Just to think about it right now.
So dentistry has changed dramatically in the
And
last
you have
40 years.
been an active spectator. You've seen the evolution. You've seen it all. I mean, the last 3 decades.
And our generation would like to think that we've been at the vanguard of change, and we've been responsible for some of that change that has happened. It was very interesting.
Those 2 years have taught, molded you to what you are right now.
Absolutely. And like I said, dentistry is a difficult profession to be in. You need lots of skills, and you got to keep learning new skills all the time.
Any patient story from your PG days, if you have one, which you can remember, which you would like to share with us?
I'd like to share a very funny story.
Okay, I'm all
just
ears.
to tell you where we have progressed from. So I was an MDS student in those days, and we used to have this wonderful dean of ours called Dr. Dayal Shani. He was over the top character, very, very, very lovable man, and inspirational in different ways. Okay. So the first time we had light cure units in 1985 or 84, 85. So I said, "Sir, I would like to see it. Come, I'll take you there." So there was this retinue of people in front of us. There was Dr. Shani in front of me, and there was me behind, and we all walked into a specially made room, which was locked. So we opened the room. The room was open. There was one chair there, and there was a cupboard on the side, which was also locked. So that cupboard was opened, and the light curing unit was taken out and said, "That's the light curing unit." So that's where we progressed from. Today, if I had to tell you that you had to lock up a light curing unit, you would probably laugh. So and those were great days because dentistry was changing.
Is that the reason why your generation values things more? Like you said, for us, we can't even think about like that. But for you, you have seen it. What's your take on that?
Absolutely. Aerotors were not commonplace in dental practices then. Remember, even in Nair, we in our what we used to call operative department, which is now restorative dentistry, we didn't have aerotors. Most of the times we were working on motors which were engine driven. Okay, so you can imagine from there to where we are today is a very dramatic change.
True, absolutely true. So you did your, that's a wonderful insight story which we came to, a small one, but, this sheds light on the value of a light cure machine. You did your UG from Nair. How was it? And why did you choose dentistry as your career?
So my father was a doctor.
Okay.
My grandfather was a general practitioner. First batch of MBBS from Grant Medical College in 1924.
Wow.
And my father was a pediatrician who did his DCH from Dublin. He was in the UK for a little while. And so they wanted me to do medicine. I mean, in my days, we had only 5 career choices. You could be an engineer, you could be, and again, I'm going to tell you a story. You can edit that if you like. Engineer, a doctor, an architect, a lawyer, and if your father was in business, you could be a businessman. But my father was not.
Got it.
None of my family was. My family was full of doctors. So one day I told my father that, look, I don't want to take science and I want to become a journalist.
Journalist?
Yeah. So because I was very interested in literature and, in languages and stuff. So my father didn't say anything. He said, you know what? Yeah, you take your choices, whatever. One day we were walking on the streets of Andheri and we met somebody who was not very well dressed and little sort of, wanting for a lot of cash.
Yeah.
And then we had a long conversation with him. My father very fondly said lots of things to him. And then we went away. And then he looked at me and he said, "That's one of the best journalists in India."
Wow. So did you do that deliberately to show you?
Of course.
Okay.
The next day, I decided I want to be someone that could have a reasonable lifestyle.
Right.
And so dentistry was the easiest option for me because I could see my father getting up at 3 a.m, my grandfather working through the day, and I didn't want that lifestyle. So I think this was an easier option.
Can I share one personal story of mine too?
Sure.
So I wanted to become a sports journalist when I was in my 12th standard. And my father and my grandfather are doctors. And I've looked at their lifestyle and it's exactly the same thing. I've seen them working throughout the day, throughout the night. And that's one reason why I did not want to be a doctor. So something common between us on that part.
Absolutely. I mean, dentistry was the easiest option in medicine, in all of medicine.
So, looking back, are there any things you wish you did more of in your BDS days?
Not really. I tell you, I learned my dentistry in my internship year.
Okay.
Those days, internship was not compulsory.
Okay.
So you had 4 years of BDS. Then you could join MDS immediately after BDS. So what I decided to do was take a gap year.
A gap year.
Okay.
Okay.
And go into the different departments in Nair so that I could learn dentistry. Really. And we had some wonderful professors in there and who were really knowledgeable and were interested in teaching. And so I would sit with them and we would discuss.
They were interested in teaching.
They were very interested in teaching. And I owe a lot of my success to that one particular year, especially in oral diagnosis and stuff like that. Like I said, dentistry is holistic. So if you spend that much time diagnosing, then you know where your problems lie. Yeah. So
there's nothing which you wish you could have done more of. I mean,
Only
you did
thing-
everything.
I wish I had spent more time doing other stuff than dentistry, which I did. I mean, I was a sports person. I did cultural stuff as well. I was a literary secretary and I used to take part in quizzes and stuff. But Nair was not GDC. So there were two colleges which were the behemoths of dentistry in those days. One was Government Dental College, GDC in BT, and Nair. And so GDC was more relaxed in terms of academics. Nair was more focused on academics. But yeah, no, I wouldn't change anything. I think I would still be the same.
Any funny story or any memorable incident from your UG days which you can share with us?
So there was, this was the first day of
BDS?
my junior college. No, I was in second year.
Okay.
And one of my classmates who became a really, well, not classmate, but 1 year junior student of mine, she met me outside and she said, "Oh, I'm just joining college and stuff." So we entered the lift and she was this tall, half Bavi, half Sindhi chick, I think, and very tall. And Dr. R.P. Nayak, who was to be our perio head HOD, walked in and he started talking to me because he knew somebody and sort of met, because I was in the hostel and he was the warden. And then this girl says, "I am so and so. May I know your name, please?" So we had a lot of characters in those days. In the staff and in the students. Yeah.
So
That made it interesting.
Was there a response from the...
He was just shell-shocked. He was speechless. That's the only time I've seen him speechless.
Any high, like one high and one low point from your UG days which you remember?
Well, I wasn't sure how good a student I'm going to be. And because I was not that interested in dentistry the first year, I again took a gap year in my dentistry first,
Okay.
like I told you that. And then I had to appear for my first year exams. And fortunately, my high point was that I came second in anatomy and I was, I think, first or second in physiology in
Wow.
that year. That really inspired me to go in and then I said, oh, that means I can do it academically as well. So that propelled me into doing other stuff.
It's amazing. So you mentioned doing lasers. So you did your MSc in lasers after completing your master's in prosthodontics. So why did you feel the need to do masters in lasers?
I actually believe that whatever you do, I try to be a perfectionist.
Okay.
Whether I achieve it or not is not for me to say.
Right.
But I at least try. I strive for it. So whatever new areas of dentistry that I'm going to enter in, and you must understand, implants or lasers were not a part of the general curriculum. So how do you educate yourself? That's why I went to the US to do my implant programs. That's why I decided to do an educational, formal, academic educational program that will allow me to practice something at the highest possible levels. And that was the only reason why.
Okay.
I did it when I was 44, 45 years old. So I wasn't a spring chicken. And I spent a lot of time going to Germany and coming back. It was a distance learning program, partly in person. So it was not that I had to spend 2 years in Germany. So which was great.
And how was the overall program?
It was more academic.
Okay.
I wish it was more clinical.
Okay.
Clinical, we had to teach ourselves.
So can you share something about the European master's degree also in lasers?
So what had happened in those days was lasers was considered a little away from the mainstream of dentistry. Okay. So there were about 5 or 6 universities in Europe. There was Rome. There was Barcelona. There was Germany, Aachen. Then there was one in France, I think Nice. So there were 5 or 6 professors who had got together, and they had proposed to the EU that we could join up together and have, if anybody passes from any of these institutes with an MSc, then they should be awarded the European master's degree in oral laser application. So that was what they called the MDola. And that was, in fact, I think ours was the second batch that got the MDola.
So you have put in a lot of, studying into laser. It's just not, something which you wanted to do because that was the only thing left to do. You did actually because you were passionate about it.
Absolutely. I mean, I wouldn't do anything just because it was going to give me
Another degree.
A title.
Right.
I didn't need it by that time because my practice was already very successful. So this was only so that I could enhance myself, and I also wanted to enter into laser academics. So eventually I wrote a little I wrote my chapter, which is lasers and implant dentistry in Springer's. It's the virtual textbook of laser dentistry today.
So how important is the role of lasers in your daily practice?
I use it.
Do you still use it?
Absolutely.
Okay.
And I think we are one of the few practices in this country. There are not that many that use the erbium lasers in their practices. And the unfortunate part is that it was marketed wrong. Lasers were marketed completely wrong. A laser is not a restorative tool. It's not a handpiece. It's a surgical tool. It's a scalpel. It's a bone removal. It is sterilizing. So if you have a cyst and you use a laser, it will automatically sterilize the areas around. So it is a great surgical tool, which has been wrongly marketed, I feel.
So, given an option, what's your take on lasers? Should people, young doctors or dentists, should they learn lasers and start incorporating after they have mastered it? Or is this something which is still a niche in your
So let me again take 2 minutes on this point. It's a very important point. Lasers are something that will enhance patient-centered simplification. So you want to make it easy for your patients. You want to make it so easy for your patients that if you tell them that I'm going to do the same procedure 5 years down the line on you, they will say, oh, what you did 5 years back? Yeah, go ahead and do it. Because the morbidity of post-operative laser therapy is so minimal, less bleeding, less pain, less inflammation. That's the cornerstone of all laser dentistry. Yes, the unfortunate part is that diode lasers, which are the more harmful ones compared to the erbium and can have deleterious effects on tissues if not used properly, because they're cheaper, companies are telling you, okay, here's a laser, this is a video, use it.
Wow.
Without actually insisting on certification. Now I believe the DCI is also doing some kind of certification programming or requirement for usage of lasers in practices. Yeah, so it is very important. Like I keep saying, education
It can
is the
become an
cornerstone.
important tool in your daily practice.
Not only important, practice builder. It can build your practice.
It's a great point. Yeah.
Yeah, it can make people easily access dental treatment rather than thinking twice. Oh, the surgery has to be done. It's going to have lots of consequences. I have a party tomorrow. I won't be able to attend it.
So you were an active an athlete in your college days. I want to know more on that.
I wish I was an athlete. I was a sports person. I wouldn't call myself an athlete. I couldn't run very fast. Let me tell you, because I'm flat-footed. So I would do long distance because that's the easier option. But yeah, I played a lot of sports, and I would thank my family for having inculcated me into the sporting thing. So I played cricket, played it for college, and I played TT at a reasonable level. I wouldn't say I was a great sports person, but I was very, very involved in sports, and I would follow all the sports that were.
So being active and doing, participating in many sports, did that help you in dentistry?
Absolutely. Remember that if you play team sports, or even if you play individual sports, your focus, your concentration, your fitness, your ability to perform under pressure, that is enhanced even in your clinical practices. And I think the most important is your ability to perform under pressure. People tend to crack under pressure.
So sports teaches you that.
Absolutely. And physical fitness, of course. It's so important to everybody's mental well-being.
Off our backs.
Absolutely. Mental well-being is equally related to physical, and one doesn't have to explain that. It's open. It's out there in the open.
Right. Any stories regarding your cricketing friends and athletes and sports players? Because you have a lot of interesting stories. That's what I've heard.
So I was very lucky to have met a lot of sports people at the top of their careers. Having maybe retired or just in the verge of retirement. So I used to know Sunil Gavaskar at one point in time because of common friends. Then I got really close to two of the legendary figures in the cricketing world, Vivian Richards and Jimmy Amarnath, who are both.
How did that happen? How did meeting with Viv Richards happen?
So that's because of Nina Gupta, who was a very good friend of ours. So because of her, we used to meet him. He used to keep coming. And Masaba is like my adopted daughter now. So we are really a close thing. And so, yeah, I don't talk to him very much, but yeah, there is a fondness there. But Jimmy Amarnath is a very close friend, and I keep meeting him all the time. And he's a wonderful man as well.
So, do they have any funny stories regarding dentists, or do you have any inside jokes?
But I know a lot of cricketing stories, which is not the real forum to talk about.
Okay.
But both of them have told me really funny cricketing stories. The one thing that Viv Richards always told me, that there are two batsmen in India, that the West Indian, the fast bowling quartet, only two batsmen that really respected. One was Sunny Gavaskar, of course, and the second was Jimmy Amarnath, because of that one series that he played, and he took them on, and he belted them to all the parks of the Caribbean. So, yeah, he always said that.
Wow. So, we'll keep a different podcast for that.
That would be interesting,
Yeah, true. So, you also go on a lot of treks, and you are a diver.
Yeah.
So, so many things you do. How do you, how did that love for, going on treks, hiking, that start? And is it something which you did from, your younger days, or is it something which you've just taken up right now?
So I did it in college days, but then I got so busy in my practice that it didn't connect for a long time. But we used to trek in college days and stuff like that. I was always very fond of the outdoors. I love nature. I love wildlife parks and stuff like that, which is one of my other favorite areas. And so I think you have one life to live.
Right.
You have a bucket list, and you got to keep ticking those boxes out of your comfort zone. I think it's very important to reach out of your comfort zone and see what you can achieve. And so I tried diving in many years back, and I wasn't too happy with my experience. But then I went through the whole again, educational protocol of PADI,
Right.
right?
Yeah.
So we did, and my whole family, both the kids, me, Shalini, my wife, we all went through the protocol, the whole thing. And then we got so immersed in it that then we took an advanced certification. So we can dive up to 30 meters now.
Wow, you've got the entire family in that.
Yeah, all of us can do that. And it's underwater is a different world altogether.
That's what they say. You see, when you come out, you see the world from a different vision altogether.
And there's no sound. So it's very quiet.
Yeah.
And it's amazing. You can see all kinds of creatures that you've never seen. Creatures is the wrong word. All kinds of marine life.
Right.
To that you never thought existed.
You're also someone who's very passionate about teaching. So I want to know more on that.
I think that really excites me. And that because I think child is the father of man. And you guys, your generation has to take up from where we are. Mm-hmm. We can tell you what mistakes we've made. We can teach you the right way if you're passionate about it. Mm. And we can guide you into taking it to the next level. I think It's very important, especially in our country where at this point, dentistry is facing a bit of a crisis because of the numbers that we are seeing.
There's a lot of misrepresentation.
And so we'll come down to that point. I think we should talk about the ethics of dentistry as well. So it's about guiding somebody with that experience. Things that you may not be able to see, not because of a lack of skill, but because of a lack of experience, can be taught very easily. And I think that's what really excites me. Like I said, child is the father of man. I want to create much bigger human beings than me. That's really my driving ambition at this point.
So when you were a dentist, when you were a dental student, and you're working with a lot of dental students right now in your fellowship programs, in a lot of implant program, what is the one difference you feel what is between you guys and the current generation?
And it's a very good and important distinction. We were taught never to question our teachers. That what I know is gospel truth. While I learn a lot from my students because they ask you incredible questions. I must tell you, the high point of my career was when I was invited to lecture for the perio grad students at the Harvard Dental School.
Wow.
And I'd spent 2 days with them, one day doing lectures and then hands-on and stuff like that with lasers and implant dentistry. And the kind of questions that I got, some of them I could not answer. Because, I went back and I read up and I said, oh, that's the question.
So that helps you as a teacher.
Absolutely.
When you get questions which you don't know answers to, you actually go back and
And you got to be honest. I don't know. But I find out.
You need to be open about that as a teacher.
Absolutely, again. Because if you're closing and that's the difference I think in the earlier days when we were students and now that's the question that you asked and that's the answer. That today people don't take you, they want to know more.
They're not afraid.
They're not afraid to ask you, and they shouldn't be. Because if I'm a teacher, I should be able to teach them properly.
So what will be your advice to students who want to make dentistry as a career, or to dental students who are already in dental school first year and second year? What would your advice be for them?
My advice to young people wanting to become dentists is that be honest to yourself. That's very important. Don't chase money. It will chase you. Eventually, if you're good, it will chase you. People are in a hurry to achieve certain financial goals which are not, but of course I can understand that, because if you have taken loans, you've spent on your education. Remember, my fee in BDS and MDS was 160 rupees twice a year. So 360 rupees a year was what we were paying.
That's crazy.
Yeah. So if you're paying 50 lakhs or whatever it is as fees, or 20 lakhs or whatever, it's a large sum of money which your parents have invested.
True.
And you have to give it back. In some ways, some people have taken loans. So I can understand that. But try to keep your ethics as clean as possible. That would be the only advice I would give.
And it's coming from you, so it means a lot. Like, you have seen everything. You have seen the highs, the lows, the good thing, the bad thing in dentistry, and coming that from you actually means a lot. So students need to have little patience, need to work on the skills, and keep upgrading themselves.
And of course, upgrading your skills, educating yourself very well, and very importantly, be passionate about what you're doing. Your passion shows. Patients can see your passion. That's what makes a practice.
Right. So is becoming a dentist or being a dentist worth it in 2022, according to you?
Not in this country, unfortunately. Because there are so many dentists who all want to practice, and there is a huge need for dentists in smaller towns at the highest possible levels.
Right.
Open really good practices and then incorporate that but they're not interested in that. They want to all stay in, of course, the big cities have their own lure. The big cities have their own advantage.
So you mean to say, if you are an experienced dentist and you move to a tier 2, tier 3 town, you can actually do good?
I know so many people who migrate into Mumbai, or Chennai, or Delhi, or whatever.
It's not worth it.
It's not worth it anymore. It used to be worth it when the numbers were smaller, but now it's becoming more and more difficult. Also remember that there is no faculty positions available in dentistry anymore. All of them have been taken. So if you're doing your master's today, you have to go into practice. A lot of people are not finding that attractive enough, because at least in the earlier days, when you got a faculty position, you had an assured income, and if teaching was your forte, then you were pursuing that.
You're also someone who is currently working in a hospital setup. So what's the main difference between working in a hospital setup and working in a private practice?
I think what I really learned, I still had the Department of Dentistry in Hinduja Hospital. What I really learned is medically compromised patients and how to treat them, which you don't really get to see in your private practice. Yeah. And so the hospital-based practices are a little bit different from, because regular dental practices, patients don't want to go into a hospital setting. It's too overwhelming for them. So they'd rather go into a really nice space, with...
Understood.
Nice,
and they attach, hospital to being a...
sickness.
Yeah, exactly.
Dentistry in a lot of ways is a wellness treatment. It's not a sickness treatment.
That's such a great line. We went through a couple of years of the pandemic and the whole situation, and dentistry, as dentists, we're one of the few ones who are affected a lot, more than other occupations, I would say. So how did it affect you, and what has it taught you?
It changed me entirely. When the pandemic was first announced, and that this is a problem, and then we opened our practice on the 8th of May, which is the day that we were asked to open. The government had mandatorily banned it. And so I was in Goa for those 8 weeks, and I came back from there because one of my patients, who was a minister in the cabinet, wanted me to treat him. So I had to come back to Mumbai because that was the need of the hour. And then we had to incorporate so many things into our practices. We were virtually astronauts. We put in HEPA filtration, big plants in our practice. Now, of course, we have air conditioning HEPA filters in our new practice in Khar. But so it also allowed me to spend 6 weeks with my family at one time without a break. And that changed me. And I said, look, this is life.
Right.
It has given you a new perspective. I was working 365 days of a year because I was working Monday to Saturday. Then I was lecturing mainly on the weekends. So there have been years when I've lectured 100 days in a year, which means I was...
insane.
Yeah. So it was completely insane, the way I was working. And I toned it down. And today, I want to finish by 5:36 in the evening. I don't want to work till 8:39. I don't want to work on a Sunday. So that has changed. I want to enjoy other aspects of my life as well.
It made us realize that life is short. It's finite. It's not infinite. I mean, so make the most of it. And when you have family around you, you like you say, we do everything for our family in a way. So when you are surrounded with them, and so as a person, mentally, how did it affect you? Because a lot of,
I wasn't scared of COVID in that respect. Of course, I took my vaccinations the moment it was announced, all that. We were protecting ourselves. We did take precautions, but we were not, and we were sensitive to our patients' needs.
Right.
Because remember, you can't abandon them.
Right.
You're there for them. I am here because of my patients. I would not be talking to you otherwise. Right? So I had to be sensitive to them. I had to keep their needs in mind. And I also had to keep my safety as the prime concern for myself.
True.
Which we did. And touch wood, I must say that we've had no incidents in all our practices through the pandemic. And now, of course, it's virtually over now.
So you're someone who inspires a lot of people, directly, indirectly. Who's your inspiration? Who inspires you?
I think my major inspiration in life was my grandfather.
Your grandfather?
My grandfather was a major inspiration in my life. He taught me honesty. He taught me self-righteousness. He taught me all of those things, even though that was my maternal grandfather was not a doctor. He was a banker, for example, as a professional. But that was one. Professionally, I think the one person, like I mentioned before, was Paulo Malo. I saw what he's done. It's an incredible... He expanded. He has a whole building in Lisbon. And he tried to make a protocol that is easily doable by other people, and it's not just about him.
Right.
So,
got it.
So that is something, if you can do that, then, because most dental chains haven't done well all over the world. Most, there are exceptions. Most haven't done well because they're all about marketing and getting the patient into the practice. They're
and
not
they also
about
follow themselves.
Yeah. So it's not about long-term association with the patients. It's not about quality. It's about numbers.
Right.
But Paulo was the first one who actually tried to get protocols set so that even other people could follow those protocols.
Right.
And incorporate that. And he did that successfully. And that's why he was successful in opening so many centers. Without him, his actual presence.
When you give back to the society, you're bound to get it back. And
absolutely.
You leave a everlasting legacy. Is there something what you plan to do? Because you have a huge legacy.
I'm not so sure about that. I'm not sure whether I really need, because nothing matters after death. Nikos Kazantzakis, there was a famous film called Zorba the Greek. Nikos Kazantzakis was the author. He said the last line was "Nothing matters after death." So really, I don't really care once I'm gone, and I'm gone. But yes, it would be nice if I could, and I have one or two protocols which people are using in their practices in a lot of areas, and and all I tell my students is, don't have to give me anything in kind. Just say thank you. That's all. That's important. I think goodwill, what you need in life is goodwill. And I think if you get that, that's good enough.
So you just mentioned you were working, easily 365 days a year. So what motivates you to, go into work day in, day out? How do you push yourself to work? Because that's something which I personally struggle with. So, something on that would be great.
It's a passion. It's a passion. Nobody can tell you. If somebody told me you're working too hard, I would say, so? I'm enjoying it. But at that point, because you're caught up in that spiral of work, you don't realize the other enchantments available in the world.
Right.
Yeah. So it's a spiral. But yeah, there's a passion to it. I want to be the best. It's a junoon. You know what I mean?
You also mentioned empathy. Having empathy in dentistry. I want to know more on that.
So dentistry is all about, again, perception of patients about the treatments.
Right.
And the first thing the patients fear is pain. So you have to be empathetic to the patient's pain. I have an incident that happened 3 days back. So this patient is a young girl in the late 30s, but all her life she's had dentistry under general anesthesia because she's had bad experiences, let's put it that way. So we tried to wean her off that. And last time we were doing it under sedation. And I said, why don't we try this? And if you feel anything, we'll put anesthetist right here.
Right.
And we went through the protocol without any sedation. And her mother nearly touched my feet. Says, wow. That, and if I had not been empathetic and I had just said that, look, okay, it's fine. We'll put you under anesthesia. Doesn't matter to me, but it matters to me. If you're not empathetic towards your patient, it's not going to build your practice. I think that's the bottom line. Empathy is the bottom line. For all doctors. It's not just us.
So you mean, but because it's not something which you can learn, easily.
You can learn. You can learn.
You can?
Empathy, of course. You train yourself to be empathetic. You look at so I don't know whether I was naturally empathetic, but in my later, now I'm becoming a little more intolerant, but I used to be very empathetic in the earlier days of my practice.
Right.
But so what happens is you put yourself in their position and say, if I was the patient and you were the doctor and the patient was the doctor, and if he reacted the way I am reacting to him, how would you feel? And if you do that, you will understand that a lot of times your reactions were slightly over the top and that you could correct them.
Right. True.
So I think that's empathy. You empathize with the patient and say, oh, I understand your problem. Let's find a solution that may not hurt you, but that will give you proper function, aesthetics, whatever else.
I think once they know that you are in their team, they also open up in a much better way. The patients.
Absolutely. They trust you. So and trust is a major factor here.
True. Dentistry and trust go hand in hand.
Absolutely. Because they're watching every move. Every move you take, every breath you make, I'll be watching you.
What do you feel about the future of dentistry globally and India to be specific?
We need to have dental insurance, if you ask me, to make it financially viable and also for a lot of our population to be dentally aware.
Okay.
How many patients come in for regular scalings into our practices? Not that many, if you look at the numbers. How many patients are really concerned about their dental health? How many people understand that the oral cavity is a gateway to your body and that a lot of the things that can happen to your body can happen through your oral cavity and the manifestations are there to be seen.
Right.
So that awareness is still not there in our population. I think if insurance comes in, people will be more motivated because they don't have to put money from their pocket into treatment. So that
might be a game changer.
Absolutely. It will have to be a game changer. If you look at what happened to the US, for example, if you look at what happened to the West, a lot of countries where social, insurance was the norm because of governments.
Right.
Their oral health is very, very good. And those countries which have to depend on either private insurance or paying from your pocket, fee for service, there the dental health is lacking.
Got it. Because I have a theory behind it. It might be funny to you, but so what I feel is we have 32 teeth. Imagine if we just had 2 teeth. So for a patient, I feel sometimes the patient also take their teeth for granted because just the sheer amount of number, they have 32 teeth. Even if one goes for a toss, they're like, I still have 31 left. So, my personal experience, they refuse to pay from their own pocket. And like you said, if you put in, the insurance in the game, probably, they will start taking better care of it. And once they understand the oral manifestation with the systemic implications, probably that might lead to overall better health.
If you take an example of somebody like Dr. Devi Shetty, what he did for Karnataka with his Bangalore, the insurance scheme, where he was offering bypasses for very small sums of money. But the government was funding a lot of that. So he went to the government. And if we can do that, if we can convince the governments that, look, oral health is very important and that you need to put in a little bit from your pocket as well.
Right.
And then, that would really take off.
What if you take one step and, the patient will take the bigger step?
Absolutely. You have to give them the avenue to take that next step.
it's a vicious wheel. Someone has to break the wheel, either the patient or the dentist. So if we put our best efforts, in doing this, probably the patient might do the bigger thing in that.
Absolutely. I fully agree with that.
So what's next for Dr. Suchetan Pradhan?
I think
If I ask you.
I just want to be a mentor that I can train. I want to leave an army of really good dentists behind, whom I can train to the highest possible standards. We've done some. I would like to do other things in my life as well, apart from clinical practices. I'm very interested in so many things in life, and I would tick off my bucket list one by one.
Got it. One thing I forgot to ask you was, you have 3 dentists in your family. So how are the dynamics in that? Do you discuss dentistry on the dining table, or how does it work out?
So we don't look. It's impossible not to discuss it when there is a problem.
Right.
Yeah, when there are some issues that need to be sorted out. Now, I'm thankful that my wife is also an MDS, and she works with me, because without her, I would not have been able to grow my practices or leave the care of my patients when I was teaching, traveling, doing other things. So that has been one of the strengths. We have also created a whole infrastructure, an army of, well, not an army, but a little small numbers of other dentists that we've trained.
Got it.
And who've been with me from 20 years, for a very long time. So we trust each other's diagnostic skills and treatment skills. So that's very important. In the family, I was against my son becoming a dentist. I actively discouraged him from doing dentistry.
Why so?
Because I felt that the future in India for dentistry, and you can see it now,
Right.
is not the best. And of course, he has a legacy that he could, three practices, if you can call that a legacy. I'm not really sure whether you could. But if you have 3 practices and you could start off on a much firmer footing than somebody who's going to start anew.
Right.
But I thought that they were the opportunities in today's world, in other areas. There's so much creativity around.
You can do anything.
You can do anything.
Right.
So that was not an opportunity for us. But he was adamant, and he became a dentist.
And I think he's doing good.
Well, only time can tell. He's young right now. We have to see what will happen. But yes, my best wishes are with him. I hope he does the best he can achieve. And he should achieve more. Look, when I started practicing, I did not imagine that I would be in this position where I am today. Okay? I think it's very important. Rather than being just ambitious, you got to strive to become a super achiever. That's important.
Got it. I mean, that's wonderful to know, the whole family dynamics, and to know that you have such a strong support system that includes your wife too in that. I mean, in a big way.
Of course, we've had discussions. So normally the rule of thumb was that you would not talk about dentistry when you come home for dinner.
Okay.
And because we were not in the same practice, it was very good. Because, otherwise it becomes this too much of each other.
Right.
And that can cause its own set of problems. But the rule of thumb was, we won't discuss dentistry in the middle of the night.
Perfect. So we'll end our podcast with a rapid fire section where I ask you a few questions and you have to answer as fast as possible. Your favorite dental instrument?
I think the laser.
The laser.
The erbium laser.
The erbium laser.
Yeah.
Any specific company or...
I don't want to get into companies. Let's keep companies out of this.
Any specific model? I just wanted to know that.
So the erbium Vias DG is what I use all the time.
Okay. Your favorite musician or band?
I'm a trained classical singer, so it has to be, at this point, Rashid Khan.
Rashid Khan.
I think he's God. Asha Bhosle. I think she's God.
Because another side of you was the music side, which we will, of course, keep it for another podcast, including your cricket endeavors. Your favorite BDS posting?
Oral diagnosis and radiology. You won't believe it.
Wow.
I learned a hell of a lot there.
One dental procedure which you find is overrated?
Overrated in terms of?
I mean, anyone can do it, but people put a point on that saying you need to be this to do this. Or it's
I think all of dentistry you can be trained to do whatever you want to do, right? I would say that super specializations like implants, I think should be left to specialists.
okay.
Oral surgery should be left to specialists. Orthodontics should be left to specialists, but everything else, I think everybody
Everyone can do it. Okay. Your favorite restaurant?
in the world or in Mumbai? I would say
one in the world and one in Mumbai.
so. I would say at this point it's Izumi.
Izumi.
Yeah, and in the world, Noma.
Noma.
Yeah.
Where's that?
There's lots of Nomas. There's all over the place, but I love them. Yeah,
Any specific dish in Izumi which you can recommend?
all their starters are amazing, and so I love all their starters.
Okay, got it. One dental institute you wanted to stay there and study for some more time.
Harvard.
I mean, because you have gone to a lot
For
of
sure,
them.
Harvard.
Harvard.
Yeah, when I went there, I saw what it's like, and it's inspiring in many ways.
Okay. One dental instrument or equipment which you regret buying or you have stopped using it.
3D printer, which I bought.
3D printer.
Yeah, I bought the 3D printer when it was in its inception phase.
Okay.
And the liquid is so expensive because it's patented liquid that I can't really use it. So it's a waste.
So you're not using it right now?
No.
Okay. You're gonna...
But I have to buy a new one.
Okay. Last one. If you were not a dentist, what would you be?
Something in the arts. I really would want to be, or a writer, a journalist, something like that.
A musician?
I'm not talented enough to be a musician. You have to understand where your
Limitations.
strengths are and your limitations are.
Any specific thing in arts which you would... You can pinpoint...
I've done theatre in the sense I've done
So like an
backstage
actor?
and stuff. Could be. I mean, that could be an entry point. But again,
I mean,
I would have to take training. I could still do it. Yeah, I've had one person, two people who actually offered me, and I said yes to them. And unfortunately, it didn't fructify. But yeah.
Okay. Thank you so much, Dr. Pradhan, for this lovely podcast. It was short, sweet, and we got to know a lot of things which we, generally don't know about you. So thank you for your time. It's something which you don't give to, a lot of people. So especially a podcast. So thank you for that. And we hope we'll have you again on another episode soon on some other topics of dentistry and more.
I'm more than happy to be here. And I think that the young have to be encouraged to do it the right, to do more and more things which are making waves today. And I think it's important that what you're doing, I think it's a great thing because you're exposing a lot of the young people to concepts, to theories that they may not be, it may not be available to them. So I'm very happy to be here. Thank you for inviting me. And I'd be back anytime at the drop of a hat. Tell me and I'll be there.
Thank you so much. It was sweet of you to say that. And we'll again have you again, probably with a lot more people so that we make it more dynamic and we... So thank you.
Absolutely. I mean, whatever. Whatever works.
Thank you for your time and thank you for this podcast. Thank you.
Thank you again.
Thank you. Done talk.
How was it?
It was perfect.
Yeah. You got what you wanted eventually?
Yes. What about you? Did you like it?
Yeah, I enjoyed it. And I went into areas which I had not thought about, right?
Right.
If you just think